Well, I had a stroke, and I never suspected a stroke. I had it in March on the 20th, and it was one of those things where I never thought I'd have something like that. Mine came from a severe headache in my temple area, but I was washing dishes in the morning, and my left arm went limp, and it was like a dish rag, and I eventually went down my left side, and I was brought to Bronson here in Battle Creek and then transferred over to Bronson and Kalamazoo for my surgery.
The day that I met Carl, he had come into the ER via an ambulance because he had recognized he was having left-sided weakness. Within 7 minutes, they had him in our CT scanner, and through exam realized that he had debilitating left-sided weakness. On the hospital floor, we ran several tests to look and see if we could figure out what had caused his stroke. And we did find that he had an ulcerated plaque in his right carotid artery that had, broke off probably and caused multifocal strokes. So, and that put him at risk to have future strokes. So at that point, our vascular surgery team got involved, and they were able to go in and successfully fix that artery, which will markedly reduce his risk to have a future stroke down the road. Talking to Carl, who is a nice guy, lived in this area, very committed to the community, worked in journalism for many years, gives back to the community, umpires baseball games. I mean, that's the kind of thing that really reinforces my desire to keep working hard to help people.
I've been in Battle Creek a lot of years, and I've worked in and around Battle Creek in many capacities. I worked for the Battle Creek Shopper News for years and been affiliated with the Battle Creek Area Amateur Sports Association. And I'm not 100%, but I'm a lot better than I was, and I've been able to do some things that I used to do. I used to umpire fast pitch softball at a full-scale level. I've not done that now, nor will I go back to that. But I found another capacity through some friendships, and through being so closely connected with events in Battle Creek. I've served as an umpire-in-chief for some baseball tournaments here in Battle Creek, which got me active and had some, filled some gaps for me.
So it's very important in stroke patients is that the symptoms are recognized and people come into the hospital via an ambulance right away, because the medication that Carl received, these type of medications that are clot-busting medications, they are safer the earlier they are given, and they are more effective the earlier they are given. In general, I think Bronson provides really exceptional care, as highlighted by cases like Carl. We have high technological capabilities, some of the cutting edge technologies for providing stroke care. Another reason that it's exceptional is just the quality of my colleagues. Surgeons like Dr. Virgin, who did the carotid surgery, have had really great outcomes like Carl's.
Well, there isn't anybody that I haven't fully thanked. My recovery was great in Bronson. The care was excellent. So you got to take care of yourself a little bit differently. You got to take your meds. You can't miss them.